Hello, welcome to Women in Surgery. I'm your host, Dr. Shlomit Schaal. I'm the Chief Physician Executive at Houston Methodist, and I am a clinician scientist and a retina surgeon. And today, my first guest is Dr. Kathleen Kobashi, and she is the chair of the Department of Urology here at Houston Methodist. Welcome, Kathleen.
Thank you. Thank you so much. I'm very excited to be here with you today.
Is it okay to call you KK?
Oh, please. That's what I go by these days.
All right. So, KK, how did you get into such a manly field, urology? I mean, first of all, is it a manly field? Is that right? Or is it my perception?
I think it is a perception, but it's getting less and less so these days, thankfully. So when I entered urology, there were 80 women in the country out of about 11,000 men. Now the incoming class, we just surpassed 10%. So we're at almost 11% women in general, but the incoming classes are approaching 50% women. So we're very happy to see this progress happening with the new up and comers.
Fantastic. But why did you choose? I mean, I thought that everybody would choose ophthalmology, right? I'm an ophthalmologist, but why did you choose urology? And was it scary for you to get into a profession that is really manly? You said 10%, so 90% men.
Well, honestly, I was a little, I don't know. I didn't really think about the fact that there weren't that many women in the field. But I'll tell you, so how I got into it is my dad is a urologist, and he didn't want to talk to me about it at all. I'd ask him about it and he'd say, you'll learn about it in your clinical years. I think it was a little bit cultural, a little bit my dad, but we never talked about it. So I was super curious about it. And I, pursued the rotations during my clinical years. But I think most urologists, when I give a talk or something and I ask the audience of urologists, how many of you got into it by luck? Virtually everybody raises their hand because urology is not a required rotation. So you have to stumble on it. But once you get in there, you realize it's actually a very fun, sort of cool, happy-go-lucky group of people who have a really good sense of humor. So it's a fun field.
So your dad was happy that you went into his field in, following his footsteps? I think it's fascinating.
Well, ultimately, yes. Once I got in, now we talk about it all the time to the point where my mom's like, no urology at the table. So, and I'm actually married to a urologist also. So.
Oh my gosh. Okay. I know that you have two college girls.
Yes.
Are they going to be urologists? Is there any pressure there?
There's no pressure. There's certainly no pressure. They both are interested in medicine, strangely enough, after watching the way we work, but neither one of them want to do urology.
So, KK, I have 4 daughters.
Oh, my goodness.
So I felt my entire life that I was role modeling for them. Mm-hmm. And every time I took a job or an opportunity, even though I was very, very afraid and scared to take it, I was like, okay, my girls are watching me. Yeah. So I'm not going to chicken out now. Has this played any part in your career, the fact that you have girls?
In a way, yes. I tell my kids all the time, and I say to the residents and fellows also, if you're not uncomfortable, you're not growing. Right? But you have to step out. And so I think that just by being there and for them watching how we function, and I have to say that my husband as a partner in all this has been fantastic, like really empowering them to pursue and not, wither away or shy away from the things that they might want to pursue. But I think inadvertently, yes, I think we both are role models in that regard to show our kids that they should never not pursue anything they want to try.
I'm very curious because you're married to a urologist, right? And so when we talk about family and when I talk to younger female physicians, they're always worried about, traditional roles of women. So you're both physicians and both urologists as well. So who goes to PTA meetings and how does it work for you guys?
Well, thankfully, first and foremost, he's been a great partner, but he's also an academic urologist. So there was a lot of jockeying and a lot of 50-50. But fortunately, he's been really great about taking half of the responsibility or the half of probably more in some regards. But I think it's all about that dance now. I think modern family is very different than it was 30 years ago when there was more of a traditional role. I think I think it's all about sitting together and making the plans and making sure that we've got everything covered, which oftentimes we don't, to be honest with you. So the girls have had to tolerate that a little bit.
I was worried about my kids for a very long time, and they turn out to be just fine. So, I think some of the worries that younger physicians have, female physicians, is, am I a good mom? Did you ever have this thought, and how did you handle that?
All the time, because there were a lot of things that I had to miss, right? I mean, you miss out on, piano recitals, ski races, that sort of thing. But it really was the divide and conquer, first of all. So I went to the ballet things, and Chris went to the ski races. But I think what's really important is when you're present, you have to be 100% present, right? The time might not be really long. It might not be every day, but the time is very valuable. So the time that you are together is 100% focused to the degree possible, and really dedicate that time.
So, how many women are like you, department chairs of urology in this country?
Well, I feel very privileged to be a part of a group of 7. There are 7 female urology chairs. I think there's 150 or 160 programs, academic programs. That's increasing slowly but surely. So we're really trying to, mentor and encourage young women to get in there. And
So you know all these chairs, and
yeah.
do they serve as any kind of support group for you?
100%. I mean, we really do lean on each other. It's a wonderful group of women who, talk about imposter syndrome. I sit there with them and I think, what am I doing in this group? But everybody's wonderful. And I think, I think that's also a big key. I mean, to really lean on your peers. Collectively, we've kind of seen most things that come our way, and you have to really lean on the collective experience.
And you learn from them.
Absolutely.
And you
100%.
taught them too, I bet.
I hope so. I do my best. But I mean, it's just sharing, and it's just that honest, those discussions that really are helpful to realize that you're not the only one dealing with these things. I mean, I think, it is, being a female leader is a special thing. I think it's a different style than what male leaders face. I think. I mean, that's that balance between being too tough or being a pushover and all of those things that I'm sure, I would imagine that you've encountered as well.
No, not at all. No, I think you're right. I'm wondering if a younger generation of physicians, urologists, do you see a trend that females would like to work maybe for a female department chair? Do you see that more, in the application, you attract more faculty members? Have you noticed that at all?
I think so. I mean, women, yes, I think there are women who really gravitate toward other women as role models, because they realize that it can be done, right? And so I think they feel like they can relate to you a little bit more. They have a lot of questions about exactly what you've asked about: work-life balance. Can I have kids? How do I manage all of that? And with partners who are in medicine or not in medicine, that makes a big difference. So yes, I think that is true. We see, but of course, like as I mentioned, there's like 50-50 now. Almost 50% of the applications are female, which is fantastic.
To urology, 50% of the applications, but not 50% of the residents yet.
That's correct.
Okay.
But we have a lot of women. We have 4 women in our department. Our residency is 15. So I should say we have 11 residents right now, because we've just increased our complement. So we're not quite to the full 15, but 4 out of 11. So we're pretty good percentage-wise.
Fantastic.
Yeah.
So we're talking a little bit about mentorship. So tell me about your mentors in an era where there were less maybe female role models in urology for you.
Right.
And then how do you mentor the next generation? And, what do you pay attention to?
So I had several really wonderful mentors who really changed my course. I mean, people who really encouraged me to pursue what I wanted to pursue. I had a wonderful mentor, a pediatric urologist, Dr. Schamberg. I'll call him out because he really changed my course, who was super supportive and really encouraging to me. And he suggested I do a fellowship at a point in time in my residency where I can tell you I was the last person anybody would think would go into any sort of leadership or academics. I hated speaking. I hated writing. But I thought, if he has faith in me, I'm going to try. And he sort of gave me a couple of choices of things that I should think about. Ultimately, I chose pelvic floor reconstruction. And that changed my course also, because my fellowship director also opened a ton of doors for me. He had, it was nice when somebody has faith in you and really encourages you to reach for the next level. And as I mentioned before, I say to my kids, if you're not uncomfortable, you're not growing. And so, I've been uncomfortable for the last 2 years as a new chair. I've been uncomfortable every step of the way, but I think that helps you grow. So I teach that too, I think, or I present that concept to anybody who asks me for any guidance or mentorship, like step out. And, if you fall down, stand up. You have to fall, you have to challenge yourself. You can't just sit in your comfort zone or you're never going to grow. So,
right. I think that's really important. And I can, resonate. It resonates really deeply with me because as human beings, we like to follow, right? What we see. You were lucky you had a father, a urologist, but some of us were not born for family physicians. So you have to imagine yourself as being a physician. And then you have to imagine yourself as being a female physician. And then you have to imagine yourself being a surgeon,
yes,
where maybe you don't have so many role models. And then you have to imagine that you're going to be good enough to pursue a fellowship.
yeah,
And then to climb the academic ranks all the way to the department chair. So I think this kind of belief really is, I think very few people just believe in themselves. They need that support and somebody that says, no, you're actually very good. You can do it.
You can do it. I think this is also a funny thing though, because I've had somebody ask me, how do you make a Grandmaster plan? I said, how do you get to that? And I said, I didn't have a Grandmaster plan. If you know that you want to be a chair one day, then I can help you make a plan. It's stepwise, where you need to be in 5 years, what you need to do. But for me, it was just, if the ball came, I hit it and then it opened up another door, and I thought, oh, I kind of like this. So, it was sort of by luck in many ways, but I think you just, like you said, you have to go for it and do your best and pursue new challenges.
So one thing is luck. One thing, you are born to the urology field. And another thing I noticed in your CV is that you went to Wellesley College.
Oh, yes.
So talk a little bit about that and how it shaped your perception as a female physician, career lady. How did it influence you, if at all?
Well, honestly, I didn't realize it at the time. At 17, 18 years old, I get sort of shipped off to college, and I went to a girls' school. Right, it's a women's college, about I think 2,200 women, something like that. So very small. There are no sororities or anything there because they said the whole place is like a sorority. But what was really wonderful that I realized in retrospect, I didn't realize it when I was there, but I realized in retrospect that it was a group of women that were very supportive to each other. I'm still in touch, with my friends and my sisters from Wellesley, because it really empowered you to pursue your dream. There was no way that you were going to say that just because I'm a woman, I can't do it. And so some women didn't want to pursue a professional career, but others did. And we just sort of shoulder to shoulder, we just, encouraged each other. And so I think it's become part of my fabric to realize that you can do it if you want to do it.
KK, I'm wondering about urology and your patients. Are there mainly male patients?
Well, when I entered urology, I would say that probably the vast majority of patients were male. As the world has evolved, my practice is probably 70-30, something like that, 70% women, because I do pelvic floor reconstruction. But I think a lot of women are coming forward with problems that are sort of fall into the field of functional urology. There's also kidney stones, of course, and all of that. But for pelvic floor medicine, it's, prolapse and urinary leakage, right? So that becomes mostly women. But I think the perception is that urology is mostly male patients. That's evolved with time, actually, as the field has evolved a little bit.
So the field evolved where there are more female physicians and more female surgeons in urology, but also the patients, more females are now going to urologists.
Yes, I think that's. I don't think it's because there's more females in
no, but
female
both
urologists.
things are happening.
But yes, both things are happening.
Both
Yes.
things are happening at the same time. And I wanted to ask you if your male patients are comfortable with having a female doctor.
Yes. Now, for the most part, I think they're okay. There are some males who specifically request that they don't want a female. And strangely, there are some males who request a female. I mean, the world has changed. Socially, we've changed. Our attitudes have changed a lot. But when I entered, I will tell you that I was resident at the VA, and people would say, I don't want to see her because she's female. And my attendings were very supportive, and they said, well, then you can come back another time because she's our doctor today.
Wow.
So, again, that was, support from my faculty, which was fantastic. At the VA, all these men would come in and they were not, well, they were very surprised when a woman walked in. And so that's really changed. I mean, I don't think there is that surprise anymore. There are some people who have, their own preference, but it's not surprise or
Yes.
shock when a woman walks in.
So it's interesting to hear this evolution of a profession really
Yes.
in your lifetime. How do you think into the future it's going to be? Let's say 10 years from now, if we sit here and I interview you, what would you say
Yes.
the changes are? And then what can we do? You and I and all of you, what can we do to make the future better for our physicians and also for our patients?
Well, that's a great question. I mean, I think that it's going to change in many ways. So we're already seeing the younger generation coming in, the applications that are coming in, like I said, are, almost 50-50 women. So the population of urologists is going to be made up of a larger proportion of women than it has been historically. I think I mentioned that when I entered, it was 80 women out of 11,000. And now I think, 10 years from now, it's going to be 30-40%, hopefully. I mean, I think it's really growing just by the demographic of people who are applying for the field. I think that changes. I mean, a lot of attitudes are changing these days, right? How we approach our patients. There are now programs where I just came back from a wonderful conference, the Society for Women in Urology. It used to be a very small group, and now I don't know how many people were there, 300 people, I think, of women.
And you told me medical students also.
There were a lot of medical students, and I was surprised. But they're also, the medical students and the young residents are much more, I think this is part of the culture changes, much more empowered and bold, maybe in a good way, to come and talk to us and say, what do I do? How do I get in? What should I do? How can I be better? What are my opportunities? Can we come shadow you? And, it's very heartwarming to see that, I think.
Yeah. What is hard about urology? I mean, what was hard for you as a human being, but also as a woman? Is there anything that you kind of say, this is going to be hard?
I think, well, it's interesting because, again, it was probably just my thick-headedness that I just really didn't think that much about being female in this field until people started pointing it out. But I do remember a day when one of my colleagues, one of my peers said, you're just one of the guys. And I thought that was the best compliment in the world, right? I mean, but so I didn't think things were going to be hard specifically because of the gender, but I do realize that people do. I mean, I try to mentor people not to let that be a barrier. Because I think people do kind of inflate that sometimes. Having said that, I mean, it's a real thing. Depending on where you are, some places are very still comments come out or things come out that are not appropriate, I guess, or not.
So you experienced that?
Oh boy. In retrospect, I did, and I just sort of blew it off. But some of the things that were said were entirely inappropriate. And you just.
So how do you, as a leader of a department where young females are entering your profession, how do you make sure that the environment is not toxic for these young ladies?
I'm very fortunate at Houston Methodist Hospital because our department is fantastic. I mean, I don't have anybody in the department who's going to say anything inappropriate that I can think of within, our employed physician partnership. I mean, knock wood that somebody did say something inappropriate or do something inappropriate. I mean, you just have to be direct. I think this is one of the things as a female leader that you have to practice and learn, that directness, right? And call someone in and just objectively tell them this isn't appropriate, but you have to address it immediately and you have to address it straight on. And you have to do that not only because it's the right thing to do, but you're representing these young women or, women, young, colleagues. You have to, that's the responsibility of a chair or a leader, in my opinion.
Fantastic. So finish up with like 3 things, words of advice to your younger self, entering the field of urology back then with what you know now. Like 3 things that you could think of that say, okay, well, either I wish I'd known, or focus on these 3 things and you're going to be happy, successful, and you're going to have wonderful kids, and and you're going to be okay.
Yeah. So I would say, number 1, be yourself. I mean, really genuine, be your genuine self, integrity. Don't ever lose that. Well, this is 4 actually. 1 is, lean on your peers, your friends, your colleagues, and your partner. I mean, that's critical. And then go for it. I mean, don't let anything get in your way. But I mean, seek out the mentorship. There are people out there who really want to help you, and there are opportunities out there. You just have to look for them, but don't be shy. That's, I think, what I would say.
Don't be shy, work hard. I would just emphasize this theme of evolution.
Yes.
That things are changing, and we all of us are part of the change. So be part of the change, be courageous, and embrace change, and then lead the way that you would like to be led.
Yeah,
right?
That's great. That's great. Well said.
All right. Thank you, KK, for being our first guest in this episode. I learned a lot from you. I hope you enjoyed too. I enjoyed it. And thank you to all our viewers.
Thank you.